Here at DBL, we're all about the facts, not the fears, and providing you info to keep you and your loved ones safe. So Dr. Payal Kohli joins us live in carte blanche white. I love it. Today you're answering a question set in about mental health. And before we get started, I've been in mental health situations. I get it. I feel you. So know that I'm taking this personally with you guys. Let's first really quickly talk about the antiviral drug remdesivir. It is being called the next big thing for coronavirus. We want to know what the real issue is here. The bottom line, Doc, what is that?
So, Tori, I want everyone to be cautiously optimistic about this. And what I like to do is use a baseball analogy. So is this a home run? No. Did we hit it out at the park with remdesivir? No. But it's sort of like having a man on first base. And so we're getting closer to getting our home run. And that's really what this drug did. But let's take a moment just to clarify who will and won't get remdesivir and what it does and doesn't do. So does it prevent COVID? No. Is it for most people out there who get COVID? The answer is actually no. So 81% of people who get COVID and stay home won't get this drug because it's given intravenously. So it's really only for that 19% of people that end up in the hospital. They're moderately to severely ill, and those are the ones that are going to get it intravenously. So I want to set our expectations because this is not a cure by any means, and it's not something that's going to change the landscape, but it does bring us closer to finding a treatment.
I appreciate your baseball analogy. I'm always Marla Hooch when it comes to my baseball analogies from a league of their own. All right, let's get to your viewer questions. Today is about mental health. I'm really glad we're doing this. Dave says, I'm depressed, but I feel like I have no right to be since my family's healthy. The lockdown's just really getting to me. Is there anything I can do to help with this? Doc, what do you have to say?
So first thing I would say, Dave, is you do have a right to be depressed because this is taking a toll on all of our mental health, and that's completely normal. The second thing I would say is that let me give you some tips for how you can get your brain out of that depressed mode. So there's a certain area of our brain that basically lights up or gets stimulated when we're depressed. And the way you can click your brain out of that mode is to try to use a different part of your brain. So let me give you some examples. You can use the thinking part of your brain, so you can do math problems, for example, or what I find more fun is to play a video game or do puzzles, you know, because that gets your thinking brain working so that your emotional brain kind of turns off for a minute. You can do the physical part of your brain, so you can go out and get some exercise and, you know, try to engage yourself physically. You can do the social part of your brain, which is, you know, calling up a friend or doing a FaceTime visit with a friend. And then the last thing I'll say is that the seeds you sow are the seeds you reap. So if you're having a constant commentary of negative thoughts in your head, just fake it till you make it. Change those to positive thoughts. Write down 2 or 3 positive things every day, and pretty soon your brain's going to start feeling more positive.
Those are really helpful tips. That's my bumper sticker, fake it till you make it, because that's what I've done my whole life. Caroline writes in, while most people are itching to socialize with friends again, my urge to isolate is actually getting stronger, and I don't feel like seeing anyone. Is this normal? Or that could be a sign of depression, right?
It could be, Caroline, but I have to say probably it's normal if that's the only sign that you're having. So if you're having anything else, any other types of loss of interest in activities, then I would encourage you to seek, you know, a professional care. But if that's the only thing, give yourself a break, because there's a lot of fear about going out right now and seeing other people. And so I wouldn't worry about it too much if that's the only thing that's happening.
Okay, have some self-compassion, Caroline. We all need a little bit of that. Our last question comes from Tom. He says, some days I'm really productive and feel great. The next, I can't get out of bed. Does the doctor know of any tips to keep the good days rolling and the lazy ones at bay?
I'm with you, Tom. This happens to me too. And what I've really been trying to do is to put structure in my day and follow a routine. Because one of the biggest challenges of working from home is that night turns into day and day turns into night, and you go to sleep at a different time every day. So it's really important to go to bed at the same time, wake up at the same time, get dressed every morning, and sit at a desk to do your work. And that's actually the act of doing that actually clicks the brain into a more productive mode. So if you skip all those morning rituals that we normally do when we actually leave the house, your brain is less likely to be productive.
Oh, wow. So it's a good psychosomatic way of doing it. Getting dressed in the morning is a good way to start also. Before we go, it's time for, someone wrote me yesterday, it's her favorite part of the day, Dr. Kohli's silver lining, l'chaim to life, everyone. I love today's silver lining because it's about dogs. Please tell me more.
The silver lining's the favorite part of my day too, Tori, and I was really happy to see this one because dogs really are man's best friend. So we know that dogs have up to 10,000 times stronger sense of smell than humans. We also know that dogs have been used to diagnose diseases in the past, like malaria, Parkinson's disease, and even certain types of cancers. So what scientists at the University of Pennsylvania are doing is actually using dogs to try to see if they can detect the scent of the SARS-CoV-2 virus, the virus that causes COVID, because every virus has a unique scent. Wow. So this is a great way, if it works, that we'd be able to use dogs to really diagnose who might be sick and who isn't sick without having to worry about all that testing all the time.
Oh my God, dog is God spelled backwards for a reason. The heartbeat at our feet. Thank you, Dr. Kohli. I surrender to your white dress. I bow down. She will return tomorrow, of course. So if you have a question about coronavirus you want answered, write us on social media or email us at info@dailyblastlive.com. No panic, just prevention, precautions.